Hi, my name is Natalie Ashley Hardy, and I chose the topic of the 2009 H1N1 pandemic. Step 1 is to gather background information. The H1N1 virus originated from swine and was able to transmit to humans, which was a new phenomenon for many healthcare professionals. The H1N1 virus was resistant to common antivirals such as amantadine and rimantadine, but was susceptible to oseltamivir and zanamivir. This was a viral strain that was never seen before from healthcare professionals, so they had a big issue in how to prevent it and how to treat the patients that were affected. They knew that it was from swine, but it was able to transmit from human to human contact, and so that was how it was able to spread so drastically throughout the US. Step 2 is analyzing the current situation. The CDC was running a clinical test on an individual who was 10 years old, and the individual just had the flu, and they found that this child was infected with a foreign strain of the flu that they've never seen before, and so they went farther into it and found out that it was H1N1, and another child in SoCal was infected as well. The weaknesses were that they had no specific plan on how to handle the pandemic, so they had to kind of wing it once it came around, and they told specific states that there was specific issues and they need to get ready for the pandemic, such as load up with vaccines and gloves and masks so that the community could be ready for the big hit. The opportunity they had was to educate the public on what serious symptoms are common with this strain of the flu and how to avoid it. They also could have created a specific plan to be prepared for any situation that's coming their way, so that is an opportunity that they can use for the future. Step 3 is to prioritize core issues. Unfortunately, the highest hospitalizations for children under 5 years old is about 2 times the amount of older children, especially ages from 5 to 24. 57% of cases were ages 5 through 24. These individuals were not hospitalized necessarily. They were just infected with the influenza and had to deal with it accordingly. 41% of the hospitalizations were among older children and young adults. 71% of the people infected had another chronic medical condition, so their immune systems were already susceptible to infection, and unfortunately they got the flu because of that. Only 13% of the hospitalizations were people over 65, which is surprising because the elderly and infants tend to have weaker immune systems, so this was a surprise to many healthcare professionals. They found that the virus is a mixture of influenza genes that have never been seen before, which is how they knew it originated from the swine, and avian, and then was able to transmit into humans, and then was able to mutate in humans and go between humans and humans. They need to prioritize education and make sure people know how it is spread among individuals and the symptoms that the virus normally has so that they can get treated accordingly. Step 4 is analyzing alternatives. I came up with 3 approaches. The first approach is to inform the public that if any person has suspicious symptoms, they should immediately report to the doctor to avoid spread and get treated as best they can. Approach number 2 was to tell those who are in contact with swine and avian and other animals who can transmit disease to have semi-annual checkups to see if they have contracted a foreign disease that's not known to any professional and the rest of the public. And then also have strict guidelines on how to handle animals that are able to transmit diseases to prevent that from happening. And my third approach is to develop a proper plan that can be executed when another pandemic rises. Step 5 is to provide recommendations. My first recommendation is for those who work around swine and avian should have semi-annual checkups to avoid contracted diseases from being spread and should be educated on what the symptoms are so they can look out for when they should go to the hospital and stay away from the public. My second recommendation is due to influenza being a virus that is hard to prevent and cure, people with any suspicious symptoms of a serious flu should be quarantined so that it is not able to spread around and is contained as much as possible until more information has been established on how to cure the illness. Step 6 is to establish an action plan. The WHO and the CDC should work together to provide specific instructions and planning for all healthcare professionals and others involved with pandemics. A goal should be made by 2020 that there is a specific plan that can be followed by all necessary parties in order for the pandemic to be under control. And by 2025, all conspiracy theories about vaccines should be put to rest, and most, if not all, U.S. residents should be vaccinated yearly for influenza to prevent anything like this from happening again. Step 7 is my opinion. So I never used to get vaccinated before because I found that if I got sick, I'd be fine and get over it, and I would not get the flu for the rest of the year. But once I heard about H1N1, I made sure my vaccinations were up to date and continued to get the flu shot yearly so I can avoid this from happening. That concludes my presentation. Thank you.